Catheterisation is an invasive procedure. Before catheterising a patient, make sure you give a full explanation of the procedure using terminology which the patient can understand. Using pictures can be helpful, and any questions must be answered and informed consent given by the patient for the procedure to go ahead. If necessary, an interpreter should be involved. A clear explanation and reassurance can help to reduce anxiety and enable a more comfortable insertion of the catheter. Make sure you carry out a risk assessment and you have asked the patient if they have any allergies and identified if they have had any previous catheterizations, urological procedures or surgery, and if there were any complications. Find a suitable environment to carry out the procedure. This may be the patient's bed or in a clinical treatment area. If required, help the patient to remove his clothes and undergarments from the lower part of their body and ask them to get into a supine or other suitable position supported with pillows for comfort. Again, giving help where necessary. Cover the patient with a sheet to maintain their dignity until you are ready to undertake the procedure. Then wash your hands in line with your trust hygiene policy. Identify and clean a suitable surface to lay out your equipment. In a hospital setting, this is usually a dressing trolley. In their home, it may be a tray or other flat surface. Gather the equipment required for the procedure, which will include a disposable apron, 2 pairs of sterile gloves, depending on which procedure you follow, a catheterization pack, a suitable solution to clean the genital area. Check your local policy to make sure you are using an approved solution, an 11mm tube of sterile lubricating gel, the correct catheter, if required, a syringe to remove any existing catheter, a syringe with a suitable solution to inflate the balloon, a urinary drainage bag, and a suitable catheter fixation device. Take the trolley and equipment to the patient. Wash your hands and put on the apron. Open your catheter pack and position a waste bag. Using a non-touch technique, open your equipment onto the sterile field. Remove the sheet covering the lower half of the body and position a towel or disposable pad under the patient's bottom to protect the bed. Wash your hands and put on a pair of sterile gloves. Place a sterile towel across the thighs and under the penis to create a protective field. Alternatively, tear a hole in the center of the paper towel and pull the penis through. Using a swab, take hold of the penis with your non-dominant hand and retract the foreskin if present. Clean the meatal area using a solution according to your local policy. Using a separate swab for each part, work from the outside in, cleaning the foreskin first, followed by the glands, and leaving the meatal opening until last. Grasp the penis firmly below the glands. Take hold of the syringe of lubricating gel and apply a little to the meatal opening. Then gently insert the nozzle of the syringe into the urethra and slowly instill the 11 mL of gel. Apply gentle pressure to the penis with the swab in your non-dominant hand to prevent the gel from running out. If using a gel with a local anesthetic, wait for 3 to 5 minutes before inserting the catheter. Remove the gloves. Wash your hands or use a suitable cleansing gel and put on another pair of sterile gloves. This will differ slightly depending on whether your trust follows the Marsden Manual or ANTT. Take hold of the catheter in its plastic sleeve and the container to collect the urine. A urine drainage bag may be pre-connected to the funnel. Place the container on the sterile sheet, taking care not to contaminate your gloves, and place the funnel of the catheter in the container. Tear off the plastic sleeve at the tip of the catheter, ensuring the tip remains sterile. Hold the penis upright and apply gentle traction to reduce the curve of the urethra at the penile scrotal junction. Gently advance the catheter along the urethra. If resistance is felt at the external sphincter, ask the gentleman to give a small cough or ask him to attempt to pass water to relax the sphincter muscle. If resistance is still felt, this may be due to an enlarged prostate gland. If this happens, carefully withdraw the catheter and seek advice from a physician to prevent damage to the urethra. Once urine starts to flow, insert the catheter a further couple of centimeters to ensure the catheter is not resting in the bladder neck. Inflate the balloon according to the manufacturer's instructions. Make sure the catheter is supported with a catheter retaining strap to minimize the risk of trauma to the urethra and bladder neck. Ensure the meatal area and penis are cleaned of any excess gel, and the foreskin is repositioned over the glands to prevent paraphimosis. Make sure the patient is comfortable and help them get dressed if required. Dispose of the waste materials. Measure the urine drained from the bladder. Dispose of your gloves and wash your hands. Make sure you document the following in the notes: the reason for catheterization, the details of the catheter, including the make, size, length, batch number, and expiry date, along with the type and amount of fluid used to inflate the balloon, including batch number and expiry date of fluid if required, the batch number and expiry date of the lubricating gel and the amount inserted, details of any problems during the catheterization process, the date when the catheter should be reviewed, the amount of urine which drained from the bladder, and any other relevant information, for example, whether a specimen of urine was taken.